Hey YouTube, this is Melissa, and today I'm coming to you with an update on my transmenoidal hypophyseectomy surgery. So, if you guys are ready to see that, stay tuned. Okay, that was long enough. So guys, if you read the title or anything like that, you will see that I ended up having my surgery and I am 5 days post-op. So if you hear my voice, it sounds kind of like I have a stuffy nose because, of course, the surgery, they went up my nose to get to the tumor. So I wanted to start the video off by saying that I'm not a doctor, so any medical stuff I say, use as your discretion. This is what I experienced, and this is what how I'm going to explain it. So I don't want anybody saying like, oh, don't do it. Just look it up yourself, go to your doctor, and you'll get your information, you know, the correct information if it's not correct. So anyway, the last video, I know I took a long time to do an update because I was supposed to do it 3 months ago. I was trying to do it every month, but it didn't work that way. So in the last video, I wasn't sure if I was going to have surgery or not. After consideration for myself, because when I told you guys that my left eye was blurred, I really couldn't see out of it, and a lot of stuff was going on. So anyways, fast forward, my endocrinologist, because I have 3 doctors that I deal with. I have my endocrinologist, I have my neurosurgeon, and I have my my neuro-ophthalmologist. So those are the 3 people that I see as, you know, for my appointments or whatever. So anyway, after that video, I waited 3 months. He wanted me to wait 3 months to see if the tumor was going to shrink. So I was on Cabergoline. During this time, everything's looking pretty good as far as my labs. So my prolactin level was like at a 240 something, I think I said in the last video. So it went down to 0. And I was losing weight like crazy, and I was looking really thin. I think I'm getting it now because I'm on cortisone steroids. So I think I'm getting a little bit of it back, but I'm almost done with that medication. So hopefully I can go back to losing my weight. And yeah. So anyway, I went to the ophthalmologist because my main concern was my eye, because everything was going good at that point. But and we did it. Oh, so we did another MRI 3 months later, and the tumor was exactly the same size. So right then and there, it was like, okay, either we're going to wait another 3 months and I can lose my sight, or we're going to go through with this surgery. So at that point, I kind of was already figuring out that I need to do the surgery. So I needed to go to the neuro-ophthalmologist to see what's going on with my eye with the tumor. So going to him, he said there was a 70% chance I could still save my vision. And, but there's, you know, it's not promised, but there's a possibility that it could still be saved. So at that time, he said my vision was getting worse, and that was in almost both eyes, I think he was saying. And so at that time, I realized, okay, either I think I just need to get it done and see if it saves my vision or if it doesn't. Because at this point, we don't have too many other options. If I wait, I could just completely lose it. And right now, I still have some of it. So, but it's like my whole peripheral was gone. So I was like, okay, I'll be okay with the peripheral gone, but if I can restore most of, you know, the other parts of my vision, then I would be a little okay. So anyway, at that time, I went to back to my endocrinologist, and I told him, let's go ahead and do the surgery. Let's get it out the way. It's summertime. My kids are out of school. I can heal and hopefully be ready to take care of them after, considering how it works, how much healing I go through. So anyway, he looked at me, he said, you know what, let's do it, because your vision, we don't know what's going on with your vision. We don't want to lose your vision, and everything, your labs are looking good, but that tumor is just being stubborn. It's not trying to shrink. So we talked to the neurosurgeon. That was another appointment. And the neurosurgeon was like, okay, yeah, let's do it. And so he wanted to do it ASAP because he's like, your vision, we don't know what's going on. So let's just go ahead and do it in 2 weeks. So I had 2 weeks to get all my labs, figure out my kid's situation, and go to surgery. So everybody was just like, go, we'll take care of everything. I have an awesome family. Thank you to my parents and my siblings. You guys are the best ever. And on August 8th, I went into my surgery. So I have some notes because I got to make sure I get everything, or as much as I can, in this video. So on August 8th, I went into surgery. I was the happiest person, probably is, going to surgery, because all my nurses and doctors were like, you are so happy and you're going to surgery. I'm like, you know what? Life is too short to be angry. So I'm going to be happy during this surgery, and I'll be happy hopefully after the surgery. And I'm going to make your guys' day however you want. I talked to my neurosurgeon that morning, and I was just like, did you eat good? I need you to be alert on this surgery, because you are the main person doing it along with theirs. So yeah, my team, my surgery team, my hospital team, they are the best. Like, come on. Like, if you guys knew, I didn't really film a lot of it, or hardly any of it actually, but they were the best team. And I will post the hospital I went to in the description box. I don't want to really give out too many doctors' names and all that. I don't know, but my team, they're awesome. So yeah. So on August 8th, I went in. Of course, they had to hook me up to all the IVs, saw my neurosurgeon before it, and everything turned out great as far as the surgery. So I was in surgery for, I believe, 3 to 4 hours. Okay, when I came out and woke up, when I realized everything happened, it was the next day, which was Friday. I thought it was still Thursday, but I was asleep that long, because they probably have you high on so many freaking meds. I know one of the meds was Dilaudid, and I hate that med because I cannot function when I have it. So I'm assuming once it started wearing off, I started waking up, and I woke up and my family was right there when I woke up. So that was the most awesomest thing ever. So I wasn't in a lot of pain during that whole time. So it felt more like a severe migraine, not like a regular migraine, even though they're painful. It was like a severe migraine. And so they gave me medications ranging from Oxycontin, fentanyl, and Tylenol, and then the Dilaudid. They ended up DCing the Dilaudid, and then just doing the fentanyl and the Oxycontin. So that was pretty good. I mean, I had ice packs in the back of my head, so just for extra relief. So I immediately went to ICU right away. So I had a arterial, what they call it, IV. And I had 2 IVs, because when you're in ICU, they want all lines open. So if something goes wrong, they can push whatever. So I have all these scars on me, if you guys can see. Like, I'm glad they did it while I was asleep, because I hate needles. I have small needles. You see my arm, it's all marked up because my IVs kept infiltrating and messing up. Like, my arms are jacked. But they will heal, because I use that good old cocoa butter and vitamin E, and they will heal. So I'm not worried about that. I have really tiny veins. Like, they had to literally come in and do an ultrasound on my veins to find out where they were, because my veins are so tiny. So yeah, so all those lines were just blowing and going, and Yeah. So I was getting stick all the time, a lot. So anyway, I was in ICU for about 2 to 3 days, and they were trying to get me out of there because I was the only one in ICU. If you guys know what ICU is, the intensive care unit, and for what the nurses told me that were there on that unit is that most of the people on ICU can't walk, talk, eat. And I was doing all the above. They started me off on a liquid diet, which was horrible. They wanted to make sure I was tolerating the food. So I realized, okay, I'm going to have to take this, make sure I could tolerate it too. So I guess, okay, liquid diet. After day 2, they were trying to get me food because on ICU, like I said, a lot of the people there, they're not eating and drinking like I am. So I was healing pretty quickly. By day 3, I was walking, joking with the nurses. The nurses loved me because I was, in my regular life, I joke a lot and I like to make people laugh. So I was doing that all throughout the hospital in that unit and the next unit that they ended up transferring me to. But all my nurses wanted me as a patient because all they needed to do for me was get me meds. I did most of my care because I was able to. So I'm not going to make the nurses do it if I'm able to do it. And like I said, all I wanted was pain pills. Give me my pain pills, I'm good. Like I told all the nurses, like, just give me my pain pills and I'm good. Like, you guys don't have to worry about me. So anyway, by I think the 4th day, they ended up transferring me to the regular unit where people like me that walk and talk and laugh are at. So I was having a good time in the hospital other than the food. The food is horrible. If you're ever in a hospital, the one I went to, it was horrible. But the nurses and doctors are the best. So yeah, you guys want to go to that hospital. I had to sacrifice the food, but that's okay because people could bring me food. So, but anyway, so they transferred me out of that unit to another unit across the way. And, I was still doing good. I had, so when I got out of the hospital, after the procedure, I had nasal packing, and one nose was packed with like the thin gauze, and one was packed with like a big piece of gauze. I don't know how it fit in my nose, excuse me, but it did. So it was packed, and then I had a covering over my face. So I looked like I got a nose job, but I did it, and I was looking kind of crazy. I will insert the picture. I'll take that L. And insert that picture. And they also had a lumbar drain for in my lower back that was draining cerebrospinal fluid. So the nasal packing was for the fluid that was draining from my nose, and they also had to do an incision to get fat out my belly to pack back in that area that they took the tumor out. So I had a small incision. You can't even see it because I don't know how much fat they used. They didn't use much fat, obviously, because my belly's still kind of there. So I figured they used really small, because the incision is like really tiny. Like, it'll be healed probably soon because I put stuff on it to make stuff heal faster. So anyway, I had the lumbar drain, which I'll insert the picture of how kind of it looks. I should have inserted the first one because there was another bag that was full of cerebrospinal fluid, and then I took a picture of the second bag. It was like only halfway full, but I didn't even show you the spinal fluid because, yeah. But I will insert the pictures of that as well. And I was in the hospital for a whole week. So by day 7, I was pretty good. Like, I was walking, talking. My headaches were still migraine-ish, but not as bad. So I was getting a lot of meds in there, though, because I guess they wanted to treat so many things. My blood pressure kept on rising. So I was on a blood pressure pill. So I went in there with 0 pills. And the people that know me, I don't like pills. So coming out of there, I was on like 100. I was on a lot of pills, not 100, but I'm exaggerating. But in there, they were doing IVs at first, and they switched to pills because I guess they're trying to wean me off the IVs because, of course, I can't go home with the IVs. I was on pills ranging from Keppra, heparin. They're giving me heparin shots, cortisol, blood pressure meds. I was on 3 antibiotics. So they were killing everything. Whatever was going on, if anything's going on, they killed everything because they gave me 3 antibiotics and I was getting them like on a regular run in the IV. Okay, eventually, as the time went on, they switched it to pill form. So I was taking about 1 antibiotic daily. And now my pills have cut to only like 4 pills. So, and I'll probably be off of them soon because they wanted me to still be on the antibiotic again. My blood pressure pill, hopefully that stabilizes. And Keppra, so I don't get seizures because I can still get seizures because they were in my head. And I'm only on them, I think, for a certain period of time as well. And then what else? Cortisol. So the cortisol, yeah. So I'll be happy when I'm off that because that does make you gain weight and I'm trying to lose weight. So yeah, but I will be on it until they tell me not to. So anyway, so like I said, I was in the hospital for a week. So it was Thursday when I went in and Thursday when I left. So everybody kept on coming. My surgeon came in every day to see how I was doing. So that was awesome as well. All his team were coming in and telling me how they saw me when I got out. I didn't know half of them because I don't remember. But it was so awesome, guys. I just want to thank God. And the best thing that ever happened to me is I can see. Guys, I can see everything and it's clear as day. Like, it's so clear. So I thank God that I can see and I can get my life back on track, because if you guys knew how miserable I was in that last video, you guys would not believe, but I can see everything now. Thank God. And they were able to get, I believe, 96% or 90%, yeah, about 96% of the tumor. He wasn't able to get all of it because he didn't want to hit other organs and mess up anything else going on in my body. So he got most of it. It could come back, but I probably have to do MRIs yearly. And they did do an MRI after and a CT scan to make sure everything's going well. Everything has been going awesome. Like, I'm almost 100%. Like, I have little minimal headaches, but I take like either ibuprofen or a Tylenol and it's good. So I'm good. I have so many goals I need to accomplish. And now that I can see again, it's just amazing. Like, I can focus on going back to school if I want to. I have so much stuff I want to do. So, and anybody that knows me, I stay on the grind. I stay on the hustle. Whatever I got to do, I will do it. And now I can, because I can see, I can concentrate. My memory's doing better. Like, everything is just going so good. And I can also do my athletic. I can just do everything. Like, everything's come into play like I wanted it to. And I thank God. Like I said, I will always thank God with my whole life. I'm so blessed. And everything just played out well. So I'm going to update you guys. I'm sorry about how I'm talking because I know I sound horrible, but to me, it's worth it from everything I went through. So, and I know it's going to clear up. I can't really taste and smell that well right now, just a little bit. And the doctor said it will come back in 6 months. So that's good. I'm not in a hurry anyway. But yeah, so I'll try to update you guys in probably a month or two. I'll probably wait 3 months because then I can know everything that's going on or went on. But from now, I've been out of the hospital for 5 days. So yeah, I'm doing really good. And so I'm ready to go back to work and work. I'm about to get on the grind and work like crazy and just live the best life I can. So this is just so much. Like, I want to travel now. Like, I'm ready to get on a plane. I don't like planes. If anybody knows me, I don't like planes or anything, but I'm ready to do that. So anyway, I will update you. My kids are home, so I got to open the door. I will talk to you guys later. Thank you guys for watching and have a great day.